Hi guys, going back to waste management, it is the dentist is actually responsible for the packaging, labeling, and transportation of the regulated waste, and they are to determine its existence. Um, Regulated waste should be placed in containers that are closable, constructed to contain all its contents. They should be made in order to prevent leakage of any fluids during the handling, storage, or transportation process. They should be labeled or coded in accordance with the regulations and should be closed before removal to prevent any spillage that may occur. So the difference between regulated waste versus non-regulated waste. Regulated waste means liquid or semi-liquid blood or other potentially infectious materials or contaminated items that would release blood or other potentially infectious materials in a liquid or semi-liquid state if compressed. So some examples that I've included of regulated waste would include pathological waste, such as extracted teeth, tissue, or bone fragments; biohazardous waste, which includes blood-saturated swabs, cotton balls, and gauzes; and sharps waste, which includes needles, scalpels, and dental probes, and etc. for all of these, because those were just a few examples that I had listed for each. Um, so regulated waste must be thrown in a certain waste container. So it can't just be thrown in a general waste like a regular trash can, unlike non-regulated waste. It is determined by the dentist where that waste goes, and non-regulated waste, or also referred to as general waste. Some examples I included were aluminum, glass, towels, napkins, and etc. It is waste that can be disposed of using a regular trash can because, unlike regulated waste, it doesn't contain any other potentially infectious materials and cannot directly affect someone's health. So moving on, if exposure is to occur in the office, immediate actions should be taken. So you should be washing the exposed area, flushing and irrigating should occur. You should be reporting the exposure immediately, and the employee should be directed to a healthcare professional for treatment. So if exposed to blood or other potentially infectious materials, you should be washing your needle sticks and cuts with soap and water for, I would say, over 20 seconds, 30 seconds, to ensure that you are washing for a good amount of time. You should be flushing any exposed areas such as your nose, your mouth, or your skin. And you should be irrigating your eyes with clean water, saline, and sterile irrigants. You should be reporting the exposure to the persons responsible for managing the exposures. And post-exposure treatment is recommended. It is not required, but it should be started immediately. And I would recommend that if one is exposed, that they would go about taking professional healthcare treatments, just in order to ensure your safety and the safety of others around you. Moving on to contaminated laundry. Contaminated laundry must be bagged or containerized at the location where it was last used. This is to ensure that you're not taking any diseases or infections that could have been spread home with you, contaminating, your house or your loved ones. So it is important that it is containerized at the location where it was used last. Um, Again, this is just so that if your clothes have been soiled with blood or any potentially other infectious materials, um, it should be handled as little as possible and just should be bagged and containerized at the location where it was last used. Decontamination in the office is super important to ensure not just obviously your safety, but for the safety of others around you. While decontaminating, one should be wearing protective gloves, using the proper disinfectant as needed, cleaning and disinfecting contaminated equipment and surfaces, thoroughly washing after an exposure, and proper disposal of contaminated PPE, towel, rags, and etc. So it is super important to wear your protective gloves just to ensure your own safety. If there were any bodily fluids or blood that is on the surface, any chemicals or contaminants that's on the surface in which you are cleaning, you should not just be cleaning with a wipe and bare hands. You should be wearing your protective gloves to ensure that you are not exposed, like your skin is not exposed to contamination. You should be using the proper disinfectant. All of your disinfectants, everything in your office should be labeled. Not everything, but any materials such as disinfectants, chemicals should be you should be using the proper disinfectant, but it should also be labeled, which is highly important. So please make sure that all your disinfectant are labeled and that you're not just using the wrong ones when cleaning off these contaminated surfaces. You should be cleaning and disinfecting contaminated equipment and surfaces. This is important for your patients that are going to be entering your room soon, because if your prior patient, just had this whole surgery done, there's blood everywhere, there's bodily fluids everywhere on the surfaces, on the chair, on the dental instruments. Well, those should not be reused, but you should be wiping down and disinfecting all equipment and all surfaces that were previously used. Even if they weren't used, it's just to ensure the safety of your next patient, others around you, and yourself. You should be thoroughly washing after exposure, even if you may not have been exposed, even if you maybe didn't even do anything but talk to the patient. You should always thoroughly wash your hands and just clean up and disinfect the area around you, just to ensure that there's no bacteria or potentially harmful materials or infectious materials that could be on the surfaces or equipment around you. So you should be thoroughly washing and disinfecting your surfaces, your hands, everything. And the proper disposal of contaminated PPE, towels, rags, and etc. Like I had mentioned before, obviously regulated versus non-regulated waste. You can't throw regulated waste into a regular trash can. It's not allowed. It's not within OSHA regulations, and you need to be noticing as a dental assistant where your waste should go, in which trash cans, and you should be disposing of any contaminated PPE, rags, towels, anything in the proper waste baskets and disposable areas. So moving on to training requirements. Those who should be trained or consider training requirements would be employees with occupational exposure to blood or other potentially infectious materials, employees who are trained in first aid and CPR. There is no cost for training during work hours, and when one should consider training, you should be training annually or with modified tasks. And if it's an initial assignment, by your employer, then you should be taking on training. So all employees with occupational exposure must receive initial and annual training. Additionally, training must be provided when changes like modified task or procedures affect a worker's occupational exposure. Training programs should include an accessible copy of the regulatory text of this standard, an explanation of its contents, a general explanation of the endemology and symptoms of bloodborne pathogens, and the employee should be able to obtain a copy of the written plan, an explanation of the appropriate methods for recognizing tasks and other activities that may involve exposure to blood and other potentially infectious materials, an explanation of the use and limitations of methods that will prevent or reduce exposure, including appropriate engineering, controls, work practices, and personal protective equipment, information on the types, proper use, location, removal, handling, decontamination, and disposal of personal protective equipment, an explanation of the basis for selection of PPE, information on hepatitis B vaccine, including information on its efficiency, safety, method of administration, the benefits of being vaccinated, and the vaccine and the vaccination will be offered to you free of charge. Information on the appropriate actions that one should take and persons in order to contact in case of an emergency involving blood or other potentially infectious materials. An explanation of the procedure to follow if an exposure incident occurs, including the method of reporting the incident and the medical follow-up that will be made available to you. Information on the post-exposure evaluation and follow-up that the employer is required to provide for the employee following an exposure incident. Explaining signs and labels and or color coding required by these regulations, and an opportunity for interactive questions and answers with the person who is conducting the training session. So these are all things that when you do take a training class, you will be subjected to be accessed to. So if you want to be accessed to any of these, such as if you wanted a free of charge vaccine for the hepatitis B, that will be made available to you through these training courses that should be made accessible to you annually with modified tasks, or if it's an initial assignment that is given to you by your employer.